Hey guys, it's Dr. McDade from McDade Family Chiropractic, and I wanted to once again thank you for watching this short video where I wanted to discuss a very, very important topic to me, one of my most passionate topics that I like to discuss with patients and people in the general public, and that's about taking care of infants and kids. And to help illustrate the importance of that, I wanted to reference an article, a research article that was published in 2006 by Dr. Biederman in the Manual Medicine of Functional Disorders of Children, and he is a German physician who specializes in neurodevelopmental conditions of kids and manual treatment of spine-related problems as well as other dysfunctions of the body. And he's coined this term K.I.S S, or kinesthetic imbalance due to sub-occipital strain. So what the heck does that mean? That means that underneath where the head is, the occiput, underneath where that is, there's some type of damage that is creating difficulty for the development of young children. And there's a couple of different predictors or factors that increase the likelihood of sub-occipital strain based on Dr. Biederman's research, and they include either a very prolonged labor or a very short labor, breech presentation, cesarean section. Sometimes babies, due to their size and pelvic distortion that the mom may have, subluxation patterns that the mom may have, will actually get stuck in uterine. They'll have interuterine positional challenges where they get stuck in a position where as they're developing inside their mother, that can contribute to these strains, as well as vacuum or forceps maneuvers that are used during the birthing process that can be very traumatic, on the child. And some of the signs and symptoms of K.I.S S, the K.I.S S syndrome, that are related by parents are torticollis, which is when the child's head is deflected to one side, restlessness or colicky type of crying where the child is you're unable to console the child, a forced extension of their back where it makes it very hard for them to relax and breastfeed or be carried or do all kinds of activities of that nature, as well as forced sleeping positions. And he has a great diagram of some of these conditions in the research article itself, and it shows a child actually in that forced extension position that makes it hard for them to breastfeed or be carried comfortably, as well as that fixed lateral flexion where the head and neck are out of alignment, and this is the position that the baby will find themselves in to sleep in. And this condition is relatively easy to correct if it's taken care of early in life, and it's been associated with all kinds of different health challenges that are very, very common in young children, from things like colic, torticollis, which we just mentioned, the deflection of the head and neck, asymmetries of the face and the head, upper respiratory infections or ear infections, as well as GERD or reflux, and constipation. Those are some of the most common symptoms that a child's developmental system or neurologic system, is under stress. Some of the other things that are noticed by parents and that this K.I.S S syndrome that can contribute to are asymmetric movements of the arms or legs, where the child seems like they're only moving one arm or leg compared to the other one, or they only learn to roll over in one direction or the other direction. And that can have a huge impact on the developing brain of the child, because without that cross-crawl pattern where they're using both arms and legs and being able to roll over from side to side both directions, you really can start to create an imbalance, a deficiency in one side of the brain versus the other side of the brain, which can show up later in life in many, many different conditions, including sensory problems, sensory processing problems, ADD, ADHD, all kinds of learning disabilities, all kinds of body movement disorders. It's really been implicated in a lot of different things. So I hope you found this information in this research review helpful. By all means, feel free to give us a call, Facebook us, leave a comment here on this video. If you have any questions, we're here to help, and I would love to be able to answer any questions that you or your family might have about your children, yourself, and your newborns and infants. And keep an eye out. In a few days, we're going to do a follow-up to this K.I.S S syndrome research review on KID syndrome, KIDD syndrome, which is the developmental problem that happens from the K.I.S. syndrome that Dr. Biederman discusses in the paper as well. So have a great day. We'll talk to you soon.